Here we are going to discuss prevention because it's a big thing that public health does, and also the use of evidence-based practice within public health. There are 3 levels of prevention, including primary, secondary, and tertiary, that provide a framework for health promotion and disease prevention efforts. Most of the time, public health nurses are focused on primary preventions, whereas clinical nurses are focused on secondary and tertiary preventions. The difference in these levels of prevention have to do with the targeted population and then also the interventions that are applied. When we're talking about primary preventions, these are actually designed to keep problems from occurring in the first place. So the target population here are the essentially well people. They don't have a problem, they don't have the disease. The primary prevention should occur before a problem develops. Specific examples of this could be wearing a seatbelt or receiving a vaccine. When we talk about secondary prevention, secondary prevention keeps problems from occurring or causing serious or long-term effects. Secondary prevention is implemented after a problem has already begun, but usually before signs and symptoms appear. These preventions target populations that share common risk factors. Examples of this would be any of the screenings that you may take, that you may be a part of, such as mammogram. It's an at-risk population that is referred to get a mammogram, and the mammograms pick up cancer before people have developed symptoms, so it's more easily treatable. When we talk about tertiary prevention, what we're really trying to do here is limit any further negative effects from a problem. It also aims to keep existing problems from getting worse. This population has already experienced the problem or the disease or injury. Examples of this would be identifying people that might have asthma in a school and working on an asthma plan for them. As a public health nurse, when we're looking for interventions to implement to improve health outcomes in communities, we're really looking for evidence-based practice. And what we mean by this are interventions that have been implemented in other populations, or there's been research done to support the use of it within your population. The evidence-based approach means that public health nurses use a problem-solving approach to find the best available scientific evidence and the best available experiential evidence, and then integrate it into whatever they're doing within their practice. The search for credible evidence includes knowledge that you're going to get from both research and non-research. When we're talking about analyzing some of the materials that we're going to be looking at in terms of best practice, we need to keep in mind when we are looking at interventions, we need to consider the effectiveness. So some of the questions that you might want to ask when we're looking at interventions to implement within our communities, is it going to be accepted? Is it appropriate for the population that we're looking at? Does the outcome of the intervention demonstrate an actual improvement to the population's health? Is it congruent with where they are as a community or in their developmental stage? What is the overall cost going to be of the intervention? This is not just money, but time on the part of the public health side and also people. Are the costs of implementing justified by the outcomes or the intervention? When we're talking about evidence-based practice, public health nurses must actually be very deliberative in their problem-solving approach in making decisions about what evidence in the literature is strong enough to support a change in their practice or a implementation of a new intervention. Public health providers often don't have adequate knowledge about evidence-based practice or tools or resources to research current evidence-based practice. There are ethical considerations when it comes to doing research. Public health can't implement experiments on their community. So a lot of our interventions come from researching trials or interventions that have been implemented in other communities and applying them to ours. It is very, very important for us to understand all of the context of the intervention and then also the population that we're working with. A lot of times, what we do is does have a qualitative nature to it, where we ask populations, we receive feedback. It may not be in the specific intervention that we're applying, but in the evaluation of our intervention, we always want to find and determine how our community feels about things. We look at case studies. There's a lot of public health case studies that are out there that can give you information on interventions. We go to our peers. So this may be another health jurisdiction. This may be the CDC. This may be a finding that the CDC came out with. We do database and internet searches for literature that does support using an intervention. And again, I do have to highlight that it has to be in context of the population, the target population that you're working with. Some of the types of evidence that you may come across or you may be able to use to support the intervention that you're going to be implementing include randomized control studies. When we're talking about randomized control studies, this is actually the highest level of evidence. You're not going to be able to implement this on a community because there is an ethical consideration. However, there are researchers and there is science, there's scientific literature that does have randomized control studies that can provide support for the use of it within your population. A good example of this would be when we're going through vaccine trials. A lot of times these are randomized control trials. And what we find in those trials can then help us to provide an intervention to stop an infectious disease. Non-randomized control studies are also used. Again, this is experimental and not something that you could implement on a community. Same thing with quasi-experimental. When we're talking about true experiments, it means that there is going to be a risk to the population, and it's not something that public health does when it comes to an intervention. When we're talking about prospective cohort studies, we can actually implement this. Cohort studies follow a group of people after something occurs to them. And what we do there is we look at what they look like long term. A good example of this is actually a heart study where they followed for 30 years a population of individuals just to see what the outcomes were. We're not doing anything different from one population to another like we would in a true experiment, but we're just monitoring and watching to see what happens or what occurs. It's the same thing with case and control studies. when we're talking about a case and a control study, we have one population that has been exposed to something, so a population that has been exposed to a toxic chemical, as opposed to a control population that has not been exposed to a toxic chemical. And so then we watch both these populations and we monitor them for a while to see if there are any health impacts or outcomes. Qualitative studies are ones where we go ask about feelings, we ask about ideologies, thoughts, we are asking the why. Um, you're going to, when you do a qualitative study, you're going to be asking a lot of open-ended questions and then drawing themes that may tell you more about a community's perception or feeling or health attitudes towards something. We also look at expert opinions, and these expert opinions can actually come from published, non-research based published articles, professional guidelines or national guidelines, organizational opinions, or a panel of experts, or even the nurse's clinical expertise. Like I said before, because it is difficult to find or perform randomized control trials on a community, when we are looking for support for interventions and we want scientific evidence to support the use of an intervention, we will find it through scientific literature that's found by a systematic review. So this would be you going and searching for certain things within the library. You can use public health surveillance data. Examples of this is data that your community or CDC share about a particular health problem, qualitative data that might be obtained from community members or stakeholders, using media or marketing data, such as you implemented an advertisement for vaccines and then tracking the appointments for vaccines the next day to see if it worked. Program evaluations are also part of the expert opinions that we may find value in and we may use to support using an intervention within a population. This slide breaks out best practices in terms of level of evidence to support it. Level 1 being the experimental study, peer review via systematic or narrative review. This is your highest level. It is evidence-based. The second level is effective. A good example of this is peer review. Level 3 is promising. It's established through written program evaluation without any formal peer review. Level 4 is usually the opinion of respected authorities, clinical guidelines. It's emerging. Ongoing work, practice-based summaries, evaluation, work in progress. And then level 5 is based on experiential and non-research evidence. So this could be quality improvement, case reports, opinions of others. So when we were talking about evidence-based practice and implementing an intervention on a community or within an individual to improve health outcomes, we need to tie it back to the core functions of public health. So that's what this slide represents. In terms of the core function of assessment, related nursing interventions are diagnosing or investigating health problems and hazards in a community, mobilizing community partnerships to identify and solve complex health problems, linking people to needed health services, and then use evidence-based practice to gain new insights or implement innovative solutions to health problems. When we talk about policy development, related nursing interventions are informing, educating, empowering communities about health issues that impact them, or developing policies and plans using evidence-based practice that support individual and community health efforts. And then lastly, when we're talking about assurance, the related nursing interventions deal with enforcing laws and regulations, monitoring health status to identify community health problems, ensuring the provision of healthcare that is otherwise unavailable, ensuring that there's a competent public health and personal healthcare workforce to provide support to them, and then using evidence-based practice to evaluate the effectiveness and the accessibility and quality of personal and population-based services.